Hi there. Today, I wanted to share with you the full story and timeline of my son's tongue tie. I am sharing the details in hopes that perhaps it'll help other parents out there who are dealing with some sort of similar symptoms or have found out that your child has a tongue tie or anything like that, because we have learned a lot by trial and error. It took us a long time to get to where we are now. And if we can save any parent the amount of time, any amount of time, then I will be happy and have been very grateful to be able to share this information. So my son, who is now 2.5 years old, when he was 10 months old, all of a sudden his sleep changed kind of overnight. And it was a little odd. I don't know why. I don't have anything to attribute to why the sleep change happened so suddenly and then stayed that way. But at first we thought it was a sleep regression. And so I remember the day and everything. This started on May 1st. And this was 2020, I guess. Yeah, 2020. So May 1st, 2020. And all of a sudden that night, my son slept terribly and we co-sleep. So obviously I was very aware that he was waking up way more frequently than he had been up until that point. And it went on for days. And so at first we thought it's a sleep regression, no big deal, we'll get out of it. Well, then we thought maybe he was teething. Time went on, days went on, weeks went on, and it was not getting better. Pretty early on in those first few weeks, we started just sleeping in the rocking chair in our basement because I went many days or many nights of waking up in bed with him, and he wouldn't let me just nurse him back to sleep lying down like we had been doing. So instead, he would just be crying hysterically. I'd have to physically sit up with him and then nurse him back to sleep while sitting up, and then lay us both back down and have him go back to sleep. The problem was he was waking at least every hour during the night. Sometimes he would wake more than once an hour. So, 2-3 times in an hour, we'll have been asleep 15-20 minutes and he's up again. And it was insane. It was nuts. And so I was becoming so sleep deprived from doing that. And I was just physically exhausted from sitting up every time. Sometimes I'd have to even stand up and rock him back to sleep, and nursing wouldn't help. Nothing would help. And so we just started sleeping in the basement in the rocking chair, and I would recline and I'd hold him in my arms. And that's not a safe co-sleeping position to be in a rocking chair. He was 10 months, so he's older and bigger. And since we were waking up so frequently, I wasn't really getting that deep of sleep, and it wasn't safe. And yet we were trying to figure out what was going on. And so this went on for months. We had told our pediatrician about it. The problem was our pediatrician was all about sleep training, and he wanted us to start sleep training at 4 months. We did not want to sleep train, and we had told him that. So he knew we were co-sleeping with him, bed sharing with him. And, he of course was let us do what we want, but he wasn't in support of that. And so when we told him that his sleep was becoming so challenging, what was going on, he basically blamed it on the fact that I was still breastfeeding him at night, blamed it on the fact that we hadn't done sleep training. So of course he's going to keep waking up, and would not listen to me and what my gut instinct was, which was something else is wrong here. And so around the same time, I, on Instagram, had found comfort in Isla Grace, the Isla Grace Instagram account, Lauren Heffernan. She's amazing. And she was sharing posts about bed sharing and, feeling confident and okay with that decision as long as you are following the Safe Sleep 7. And so through her content, I started to learn about root cause of sleep issues with babies, and how different things can be going on that can prevent them from sleeping well and soundly. And that hourly wake-ups are not normal for a baby. Waking every 2 hours is pretty normal for a baby of that age, but every hour or more frequently than that, not normal. So I started to learn about these red flags and these different things that could be a problem. We learned that low iron status could lead to these frequent wake-ups. And so we got him tested at his 12-month checkup. His iron was a little low. We didn't do a ferritin check because that was a full blood draw, which we didn't want to do, but his hemoglobin was even on the low end of the range. So our doctor felt like that was, reason to supplement with iron. So we started doing that. Like, same as before, weeks went by, months went by, nothing really changed. And around that time, I also had learned about the impacts of a tongue tie on sleep. And the thing is, our pediatrician, when our baby was born and he had his first checkup with the pediatrician, he said, "Oh, no tongue tie." Checked his mouth, said no tongue tie, nothing there. So that was the only experience I had with tongue tie, or even knowing what it was that our pediatrician had checked for it at birth and said there was no tongue tie there. So the other thing too was that when we were first breastfeeding, we had some major challenges with Latch, and I had to use a nipple shield at first. Went to a lactation consultant a few different times, and my baby was never checked for a tongue tie being the issue. So fast forward to now, he's 12 months old. We've been having the sleep challenges for 2 months. We're trying iron. Another couple months go by, nothing's happening. So I take him to a pediatric dentist who specializes in checking for tongue ties based on what I had learned from the Isla Grace sleep account and from Lauren. And I actually even took a course on baby-led sleep to become a consultant, because I thought if other parents are dealing with this, I want to be able to help them too. We ended up at this pediatric dentist's office, and she took a look and said, yes, he definitely has a posterior tongue tie. And she also suspected that his adenoids were enlarged. And she said, I would not recommend, fixing it at this point. He's already 14 months old. It'll be hard to do. And so instead, I would let it go. And in a couple of years, when he has his first pediatric real dentist appointment, then we can take a look and decide. And she said, unless you start to really notice things like open mouth breathing and snoring and issues like that, otherwise I would leave it. So that made me think that that wasn't really the issue causing the sleep problems. So we went on, months went by, the iron hadn't helped. Obviously, we thought the tongue tie wasn't the issue. And as we started doing more research online, read an amazing book called Jaws. And I can mention the author in the comments or in the description. It's Sandra Kahn, Dr. Sandra Kahn, and somebody else, I think Paul Ehrlich, possibly. So I'm sorry if I'm messing that up. Like I said, I'll put the proper attribution in the description. But read this book, and in the book, they talk about how over time, and with the practices that we're doing as a human population today, feeding soft foods to our babies, more frequency of formula feeding over breastfeeding, those types of things are changing the way that jaws are developing. And also the authors talked about tongue tie and what can happen to the airway and to the body when the tongue doesn't have the full range of mobility it needs to rest at the roof of the mouth where it should be resting properly. And so essentially, after reading that book, that's what really connected the dots and made us think twice about the tongue tie, and that maybe it was what was causing the sleep issues. The thing is, you hear so much about tongue tie and breastfeeding challenges, and that's really it. You don't hear about how having a tongue tie can impact a lot of other things related to digestion, sleep, as we saw, and then just overall airway health. And as that baby grows into a child, into an adult, that can impact their just daily satisfaction of life and just daily happiness and feeling good. And that's because it can affect the airway, which has so many different impacts on other parts of our health and how we're feeling. And if we can't breathe the way we're supposed to be breathing, or if we're not sleeping the way we're supposed to be sleeping because our airway is too narrow, or we have sleep apnea or from the tongue or whatever's happening, then that just causes a whole range of problems. So after we read that book, we started again down the journey of the tongue tie stuff. And we went and saw an ENT local to us who checked him out. And we also x-rayed for adenoids. Sure enough, he had enlarged adenoids. And she said, yes, he's got the tongue tie, and he had a pretty tight lip tie as well. She wanted to reduce the adenoids by surgery, and did not want to fix the tongue tie because of risk of not being able to do the aftercare exercises that have to be done to help strengthen the tongue. And that with a toddler. So at this point, my son was now 18 months old. So, so he's 1.5. So she said a toddler is very difficult to do these exercises with, to help strengthen the mouth afterwards. And then also just to make sure that the wound heals properly. She didn't want to revise the tongue tie. So in this book, Jaws, that I'm talking about, there's a mention in there by, a scientist or a doctor who did some, who asserted that it's likely enlarged adenoids and tonsils are a result of open mouth breathing, not the other way around. So essentially that enlarged adenoids or tonsils are a symptom of something else, not the cause of something else. They should not be enlarged, unless something is causing them to be enlarged. So my son, as we start learning all these things, and then we start looking back at what types of behaviors my son was doing, there were a lot of times that my son would be sitting with open mouth posture and his mouth just kind of hanging open. And then there'll be other times when he's sleeping that he would be sleeping with his mouth open, but not all the time. And so that's why when he was littler, I didn't think it was a red flag, because he didn't always sleep with his mouth open. He sometimes had some noisy breathing, but not always. And so I didn't realize that, what was going on. And so after we read that book, and, we even reached out to the author, Dr. Sandra Kahn, of that book, and we had a consultation with her virtually and talked to her about a few things. And she also felt too, the same way we felt, that if we only fix the adenoids, that is potentially only fixing a symptom and it's not getting to the root cause. And then what do we do? So we decided, my family, we decided to forego the adenoid surgery. I wasn't comfortable with doing general anesthesia at such a young age anyway, at that point. And instead, then we reached out to an amazing pediatric dentist or holistic dentist overall. She sees adults and pediatric patients in Denver, and her name is Dr. Elizabeth Turner in Denver. I'll provide her information as well. She's extremely knowledgeable on tethered oral ties, which is the name of this whole field of having, a tongue tie or a lip tie or any ties within the mouth that are causing restriction or not allowing normal function of the mouth. And so we traveled to Denver. We were on our way to a ski trip. We stopped and we met with her, and we had my son looked at, and turns out he had a very restrictive posterior tongue tie. We revised that. We revised the lip tie as well at the same time. This is now a full 8 months since this started. So this whole time, all of these 8 months that, we had been trying to figure all this out, still the same terrible sleep at night. So you can imagine I was, pretty exhausted, but honestly, I think at that point, my body just got used to such terrible sleep that I was fine. I mean, no one in my external world, other than my close knit family, knew anything was wrong. I mean, they knew that Brooks was having sleep challenges. They knew that was hard, but so people didn't know that this was going on the way that it was. No one knew the sleep was as bad as it was. So we portrayed a pretty normal looking life. Everything was good and fine and fun and happy. And we were, but nighttime was a really dark time for us. So anyway, that first night after he had his procedure done, he had the tongue tie revised and the lip tie revised. That first night, he slept so much better. We didn't even have to go down to the rocking chair. We had driven home that day. We were back home. We did not have to go to the rocking chair. That was the first time in 7 months that we didn't have to sleep in the rocking chair that night. And we haven't had to sleep in the rocking chair since. I mean, it continued after that. Sleep was so much better after that. And, now fast forward, he's 2.5 years old, and we still co-sleep, and he sleeps so much better. He still wakes up a couple times, but I'm not worried about that. Before we had all those issues going on where he woke up just so upset and just uncomfortable seeming. And, it was obvious something was wrong. Something was going on. So now he's doing wonderful. He's so much better. Sleep is so much better. We're all so much better. And as I have learned more and more about the tongue ties and the different symptoms that can be present, looking back, I see that there were things going on related to the tongue tie that have since improved. Back then, when they were going on, I didn't think anything about them. I didn't think anything was a problem. His speech had not started yet. By the time we got him revised at 16 months, he hadn't said any words at that point. As soon as we got it revised, we started, a few weeks after, I guess, we started doing speech therapy and occupational therapy. And after that, his speech just flourished. All of a sudden, he just starts saying words. He's saying new words all the time, putting things together, phrases and sentences. And now, you would never think there was a speech delay there at all, but it didn't happen until we had the revision. And then we started the therapy, and he started learning how to use his tongue in different ways. Same thing with eating solid foods. He didn't have much interest in eating solid foods when we started introducing them. And that went on that whole time. He much more interested in nursing, and then only certain foods would be okay. He would chipmunk food in his mouth and just kind of hold it there. He would spit food out a lot, even when he was older, past 12 months, going into, year and a half to the time when he got the revision done. And so just, some different issues with swallowing, with spitting out foods, not being interested in trying many different foods. And then when we got the revision done, slowly after that, wants to try all kinds of different things, eats a normal amount of food for his age, and doesn't spit out the food, doesn't chipmunk the food. Just a lot of different things happening like that. And then he also had some decay on his front teeth, which we believe was partially caused because of his, a couple things. Possibly the open mouth breathing doesn't allow saliva to rub over the teeth, which helps move away that, food particles or bacteria or whatever is there. And so when you have the open mouth breathing and it's just dry, our saliva serves a purpose. So that could be part of it, but also it could be that the lip tie and not being able to get his tongue underneath the front of his teeth couldn't move it away either, with his tongue. So we don't really know, but anyway, the decay stopped, and we have been working on, natural methods to improve that, to remineralize his teeth. Another really, really cool change that happened, we saw it the first time I noticed it was 8 weeks after his revision. All four of his front teeth were completely together before the revision, no spacing. And if you know about proper growth of the jaw, children should have spaces between their baby teeth, because that's their jaw growing properly to allow room for their adult teeth. So my son, I was very aware, knowing this, that all four of his front teeth completely tight together. Like we, use floss, and you'd have to work the floss in there and pull it back out. So at 8 weeks after the revision, you started to see little spaces between the outer two teeth and the inner two teeth. 8 weeks was all. And so I attribute it to, being able to put his tongue up to the roof of his mouth. That first night I said he slept so much better. He was putting the tongue to the roof of his mouth. I'd open his mouth and he was doing that. He never did that before. The tongue never went up to the roof of the mouth when he would sleep. And that first night, as soon as the revision happened, he was able to do it already. So that was just incredible to see that only after 8 weeks, he had already that physical sign of improvement in his teeth. And now I'll put a picture up on the video of what his teeth look like now. Massive spaces between the outer two teeth and all of his teeth. It's changed so much in the time that we got his revision done. So like I said, I'm sharing my story because in case it helps other parents out there. We went through a ton of reading and researching and learning and talking to so many different people. Unfortunately, my son got a little bit of like he has some fear of providers, because he saw so many providers who stuck their hands in his mouth and had to get x-rays done. And then it made follow-up appointments with his new pediatrician or, his dentist or anything like that, made them difficult because he's just scared of anybody who looked like some sort of, doctor or professional in that way. So if we can, again, save other parents, other children from having to deal with that, then wonderful. And my word of advice would be, though, that make sure if you think that your child is experiencing symptoms of a tongue tie and you have been told that the tongue tie is not it, I would, highly encourage you to learn who a preferred provider is, because not everybody who says they have education in tongue ties actually has the extent of education needed to be able to diagnose them properly. And then also there's a group of people in the tongue tie topic who believe that tongue ties really are just a breastfeeding issue, and that we really shouldn't revise them unless it's causing severe feeding issues. And even then, maybe it's not worth revising. Whereas if we look at the developmental side of the jaw and the airway and growth, and all of the impacts that having a tongue tie can lead to, especially once you get into adult life, there's a ton. And in my opinion, I am so grateful we fixed the tongue tie when we did. It was hard to do at a toddler age, but we did it. We did the exercises. We were able to figure it out. And I'm so, so grateful we figured out when we did, because if we had waited, I don't know what would have happened. And of course, I wish I had known earlier in his life that this tongue tie was there, because I would have gotten it revised as soon as we found out. And it's, if I had known what I know now about the symptoms that can show over time. And so I am happy to talk with anybody who has questions about, my experience and just what we learned and what we went through, or tips or anything like that, anything that can help. Obviously, I'm not an expert in tongue ties, or I'm not an expert in diagnosing them. I'm just a parent here, but I have learned a lot of information along the way as far as getting second opinions and third opinions, and what types of medical providers are more likely to be experts, and where to find those experts. I'll list some resources again in the description, and I'll list those for parents in case they're helpful. But I don't know, I just love to talk about it because I just think it's so amazing, like what we went through, what my son went through, and how much better he is, like how much he changed as a toddler, even as his mood and his personality, and just so many different things. So again, whoever's watching this, if it's helpful to you, I'm so glad. And thanks for listening.